scanning the room.
Hello, my name is Joyce Jones, and today I will be demonstrating medication administration via IV bolus and a large volume IV bag. So the first thing I have done is I have performed hand hygiene. I'm in the med room and I have obtained my MAR and my healthcare provider orders. I've double checked the name, the date of birth, the allergies, and the medications, and all of those are matched. And so I will just go ahead and start my second med check. So for my second med check, I'm going to once again double check these along with my medication. I'll go ahead and start pulling those out of the Pyxis. So I have my morphine, it's 10 milligrams per milliliter, and the doctor has prescribed 4 milligrams IV push. So I've done my dimensional analysis, and I know that I need 0.4 milliliters and reconstitute that with a milliliter of normal saline. The vial is intact, it's not expired, the color and clarity are fine. And so then I'm just going to double check my potassium, and so I have potassium, and I've done that dimensional analysis. It's the correct medication, the right dose, and I know I need 10 mils of that. So to get started, I will go ahead and clean the vial on my medication, on my morphine, and I've already went in and assessed my patient and found a need for her to have this medication. She said she has a pain level of 10 out of 10 and she really needs some morphine. So I have my 3 ml syringe, it's intact, it's not open. I'm going to go ahead and open that up and get my withdrawal needle while that alcohol dries. Okay, and I will go ahead and uncap and draw up 0.4 milliliters of air to inject into the vial. Okay, so I'm just going to go ahead and inject that in there, and then I'm going to make sure to pull out 0.4 mils of morphine. I want to make sure that my bevel is in the liquid and careful not to get any air bubbles. And then I will definitely verify this with the second nurse. Okay. Come on. Okay, I'm just going to pull a little extra so I can get that air bubble out of there. Okay. And I want to make sure that I have 0.4 milliliters. Okay, and just verifying that with the second nurse.
Yep.
Okay, perfect. All right, and so now I will go ahead and reconstitute that with my saline. This saline is never been opened, it's not expired, everything's fine. I'm just going to release that pressure, insert my needle, and withdraw a full mil, which puts me at 1.4 milliliters of saline. I just want to make sure that I don't have any bubbles in there. Okay, and 1.4. Okay, and so I'll discard this and just double checking again that there are no bubbles and verifying that with the second nurse.
Looks good.
Okay, I'm going to go ahead and recap this using the scoop technique. I'm going to dispose of this needle into the sharps, and I'm going to put on this handy dandy little blue thing to keep that syringe sterile. So after that, I will go ahead and label this morphine with the dose and my name, and I'm going to set this aside for administration to the patient. So now that I'm done with that, I'm going to go ahead and get my potassium ready. So as I stated before, I did the check with my potassium, did my dimensional analysis, and I know that I need that 10 mils. So I'm going to go ahead and clean the vial for 10 to 15 seconds. While I let that dry, I'm going to go ahead and get my 10 milliliter syringe ready. These packages have not been opened, they're not tampered with, they're not expired. Okay, getting my withdrawal needle ready. Okay, I'm going to go ahead and pull up 10 mils of air. Inject that into my vial that is now dry. Okay, and I'm gonna pull out the 10 mils of potassium that I need, making sure not to get any air bubbles in there. And then I will have a second nurse verify this as well. Okay, this bottle's leaking a little because it's been poked so many times. So I'm just going to pull back a little bit more because I do see that I have an air bubble. I'm just going to get that out and push it up to the 10 mils. Okay, and verify that with the second nurse. That's 10 mils.
Yep.
Okay, and I will go ahead and recap this using the scoop technique while I get my normal saline ready. So this packaging is not open, it's not tampered with, the medication is not expired, it is the right dose of the right medication. I'm just going to squeeze around and make sure that it's not leaking or anything. That looks good. So before I get started, just so I don't forget, I'm going to go ahead and double check that I have the right label with the right name and date of birth, and I'm going to add on what I reconstituted this med with, or what medication was added. And I will go ahead and clean the port. And get this ready for insertion. Okay, so I'm just going to take off that cap and make sure to stab it without puncturing the rest of the bag. Okay, just being careful not to puncture that bag. I'm going to go ahead and put this potassium in the sodium chloride. Okay, I would activate the safety, and this is going to sharps. Okay, and then I'm just going to mix this lightly without causing any air bubbles or anything. Now that that's ready, I'm going to take my medications and my MAR and healthcare provider orders, and I'm going to the patient's room. Okay, so before I left the med room, I washed my hands. I got new gloves and all that. Okay, so for my third med check, I've verified my patient and double checked that with my MAR and healthcare provider orders. I see she has an allergy to codeine. I've explained the procedure to her, and she's ready for her morphine. So to get started with that, I've double checked the dosage and everything with my healthcare provider order and my MAR. So I'm just going to go ahead and unlock this saline lock, and I'm going to get ready to administer this. Okay, so first I just want to check for patency. So I'm going to take my 3 milliliter syringe. I'm going to release that pressure, and I'm going to check for patency, making sure to look for any infiltration or anything that may cause my patient harm. And everything looks good, so I'm just going to unhook that. I'm going to stay holding on to this so that it stays sterile. I'm going to take the cap off of my morphine, and I'm just going to go ahead and attach that to my saline lock, and I just want to make sure to push this really slow. It's going to take about 2 minutes for this amount of medication, but for the sake of the video, I'm going to go ahead and push it, but just know that I would go slow. And now that that has been administered, I will put this in the sharps. And I'm going to go ahead and close. Oh, just kidding. I'm going to flush. So I've got a new saline that's not expired. It's been open. I'm going to release that pressure, get out that bubble, and I'm going to flush it again. Again, just double checking that it's not causing my patient any harm. Now that that looks good, I'm going to go ahead and cap or close this here, the lock on the saline, and I'm going to get ready to administer my potassium. So again, I've double checked my potassium that matches my provider's orders, and the bag and the reconstitution. Everything matches up with my patient. So I will go ahead and get my tubing ready. Okay, so excuse my tubing. This has not been opened. It has not been tampered with. It's not expired. But I have used it an awful lot in practice, so we'll see how this goes. So So I'm just gonna go ahead and get this untangled because it's really tangled up. And I just wanna make sure to keep this from touching the ground. Wanna make sure that my cassette is closed, okay? And, alright, so now I need my potassium. Okay, I'm just gonna go ahead and uncap this and spike my bag after I take my alcohol wipe and clean this port for 15 seconds. Now that that is dry, I'm gonna go ahead, oh, wrong port, just kidding. I'm gonna uncap this, and I'm gonna go ahead and spike that bag. Okay, now my bag is spiked. I'm gonna hang this up, and I'm gonna get ready to prime my tubing. So I'm just gonna make sure that I invert this so that it fills Minnesota first. Open this cap, and once again, this has got a lot of it's got a lot of use lately, so it may or may not work properly. Okay, I'm just gonna fill my drip chamber about halfway. I would be double checking to make sure that there's no bubbles in my line. I'm gonna invert that, close that off, and my tubing should prime, making sure to keep that part sterile. And okay, and so now that my tubing is primed, I'm going to go ahead and take this blue piece and put it on the end so that when I get ready for administration, it's sterile. Okay, just gonna pop this in here and close that. Close that off. Make sure that this is up high so that it's not contaminated. Okay. Now I will just double check that my port is open, and double clean that for 10 to 15 seconds. Okay, and now, oh yes, and I would add a IV tubing label to right under my drip chamber. And so I've cleaned that, and now I'm just going to get ready to get this IV started. So I will be careful to make sure that I keep that nice and clean. I'm going to go ahead and insert that in. Okay, and as I said before, there's no bubbles in my tubing. I'm just going to push start, get that set up to 125 milliliters an hour. I know it takes about 2 hours for that to infuse. So I'll come back in a few minutes and I'll double check with my patient and see how her pain is doing, how she's reacting to that morphine. I'm going to take these into the med room and dispose of them with a second nurse, as well as clear the pyxis. And perform hand hygiene, document what I did here today, as well as what the reconstitution was, the medications I used, the site, and all of that, and wash my hands, throw away my gloves. Okay, and now it's been 2 hours, and I'm ready to discontinue this IV pump. So I've double checked that my patient has the need for that. I've double checked her name, her date of birth, her medications, and her allergies, and she is good to go. So I will go ahead and turn the pump off, stop the infusion, turn the pump off, and I'm going to clamp this tubing here so that I can, I've added new gloves. I put on new gloves, perform hand hygiene also before I did that. Okay, and I've closed it off. Now I'm just going to go ahead and discontinue this IV. Okay. Now I'm just going to flush that site one more time to make sure that I get all that med out of there. Okay, and so now I have flushed it. Everything looks good. The patient says that she doesn't really need anything else as we go in the sharps. And I'm going to lock this. Document that I discontinued this IV, the site, the assessment of the site, my name, the date, the time, and perform hand hygiene, clean the room, make sure safety measures are taken, and that's it.